So in this week's update from the Institute for Health Metrics and Evaluation, we are seeing a number of developments around the world that at the highest level can be summarized as outbreaks driven by the spread of the Delta variant. Generally speaking, if we sort of go region by region, the good news in South America is that transmission is trending down finally. But in contrast, in Central America, particularly Cuba, many states in Mexico, and 38 states in the United States, transmission is increasing. We think this is largely due to the spread of the Delta variant, although low sequencing rates in Mexico make it hard to be absolutely sure. But the timing, the geographic proximity does make it seem like the Delta variant is fueling these increases. And these increases in transmission are occurring in places, some of them with 50% of the population or even higher in the US, for example, that are vaccinated. So they are occurring in the unvaccinated and breakthrough transmission in the vaccinated. Similarly, we're seeing this sort of mixed pattern of Delta surges in select countries in Europe. So the Netherlands, Spain, Greece, Cyprus, having surges that have erupted rather abruptly due to the Delta variant, and yet we're not seeing yet those same types of surges in Germany or Italy or in many other parts of Eastern Europe, but are seeing large Delta variant surges in Russia and in Kazakhstan and other parts of Central Asia. Elsewhere in sub-Saharan Africa, many countries with surges, albeit there have been some that went up like Uganda and Zambia and have peaked and started to come down, which holds out the prospect that we will see less dramatic sustained surges in other countries in Africa, perhaps. And of course, the other big story is the eruption after relatively good control of COVID in Southeast Asia, in Thailand, Vietnam, in Indonesia, particularly Malaysia, large surges due to COVID. When we look at our models out the next 4 months, the timing of the Delta surge is absolutely critical, as is, of course, the race against the Delta variant in terms of vaccination rates. So our models for the world are certainly an increase in forecasted cases compared to our last release 2 weeks ago, an increase in deaths. But in general, our global forecast is for this sort of current Delta surge to play out, lead to increased numbers between now and early September, a decline globally, and then a return to increasing numbers at the end of our forecast window. And when we run the models out farther, we see a Northern Hemisphere surge coming later in the year as well. So the main messages, I think, from this week's analysis is the dominant role of the Delta variant, that even in places with quite substantial vaccination rates, for example, Israel, we are seeing increased transmission, even in places with the so-called higher quality vaccinations, the mRNA vaccines. There's enough breakthrough transmission that we see enough susceptibles of the population to enough kindling, so to speak, to see transmission continue to expand. This holds out the prospect that we could see Delta surges, even in the places where our models don't yet say they're coming, if the ingredients are there. And the ingredients, of course, will be fewer people with previous infection, lower vaccination rates, and behaviors that are going back to sort of pre-COVID levels of interaction and minimal mask use. I think as we move forward, the recommendation from many public health authorities that it's okay for vaccinated individuals to not wear a mask will probably need to be reconsidered in those settings where there's a major surge due to Delta, since we now know that the vaccinated play an important role in at least getting infected and very likely contributing to transmission.